Neurology quiz number 53. What are the clinical features and treatment of blepharospasm? Blepharospasm is a type of focal dystonia which causes involuntary eye closure due to excessive contractions of the orbicularis oculi muscles. Prior to development of sustained blepharospasm, 30% of patients complain of increased frequency of blinking. There may be associated feeling of irritation in the eyes and photophobia. This progresses to clonic and later tonic and sustained contractions of the orbicularis oculi, leading to forceful closure of the eyelids. Other muscles, including the corrugator and procerus and frontalis muscles, may be involved. Spasms of the orbital portion of the orbicularis oculi cause lowering of the eyebrow beneath the superior orbital margin, also known as Charcot's sign. Sensory tricks and maneuvers such as pulling on an eyelid or eyebrow, placing a finger alongside the eye, pinching the neck, humming, etc. may decrease the spasms. Here the first figure shows the occurrence of blepharospasm, while the second figure shows the anatomy of the orbicularis oculi muscle, which is primarily involved in causing blepharospasm. Blepharospasm can vary from a mildly annoying condition to a disabling disorder that interferes with activities such as reading, watching TV, and driving. It can be of sufficient severity to make the patient functionally blind. Severity can be assessed using the Jankovic rating scale. It can be associated with oromandibular dystonia, causing involuntary contractions of the jaw and tongue muscles, dysphagia and dysarthria. This combination is also called Meige syndrome. Some patients may have associated dystonic movements of the limbs. Apraxia of eyelid opening can be confused with blepharospasm. This is a difficulty in voluntary opening of the eyes in the absence of contraction of the orbicularis oculi muscles. It can be seen in Parkinson and Huntington disease and may coexist with blepharospasm. It has been attributed to inhibition of levator palpebrae superioris muscle. This figure shows a patient with Meige syndrome. Patient has blepharospasm and facial grimacing due to contraction of the jaw and facial muscles. Blepharospasm may have a genetic basis, as 25% of patients with focal dystonia have a positive family history of dystonia. It can occur in association with other neurodegenerative diseases such as Parkinson's disease, Parkinsonian plus syndromes, inherited dystonia, spinocerebellar ataxia, and can also be seen as a feature of tardive dystonia. Botulinum toxin injections into the eyelids are the treatment of choice. These provide improvement in 70 to 90% of patients. Patients who do not respond to botulinum toxin can be offered surgical treatment in the form of orbicularis oculi myectomy. This figure shows the sites for injection of botulinum toxin into the orbicularis oculi muscle in blepharospasm.